Nobody ever talks about this and the fact that there is a difference between needing to be induced and being ready to be induced. So today I'm going to give you 3 signs that show that you are ready to be induced. We're going to dive in a little bit more into how to know if an induction is right for you when you're sort of in that gray zone of induction area. And maybe the reason we don't talk about this very often is that it is pretty complicated. When you get a patient who is directly in the gray zone area, where it really is up to them if they want to wait or if they want to get induced, how do you choose? And it's really up to each specific person and you getting information from your expert in the room, which is your doctor or your midwife. And today I'm going to pretend to be one of the experts in the room in case we haven't met yet. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've seen so many patients in this gray area, and they don't understand all these different things about like how you might be ready to be induced. So I'm excited that you guys are here. Give me a like and a follow if you're interested in high quality expert pregnancy content. Now, before we dive in, I just want you guys to be clear on what you want for your upcoming birth, and I think that is best done with a birth plan. Is birth plannable? Absolutely not. But do you want to know what's important to you? That's why a birth plan is important. I have a whole Birth Plans Made Easy series. I'm going to put the link down below. And if you're looking for the reasons to get induced, those are a little bit different, and I have a whole video on those. I'm going to put it either up above or down below. Okay, and one more thing. I know you're like, Hilary, just get to the ready part. But I want to remind you, because this is so important and sometimes providers forget it, induction is always your choice. Now, your provider might say something stupid like, we are going to induce you at 37 weeks. That is not their choice. We are going to offer you an induction at 37 weeks. Are they going to change their language? Gosh, I hope so. But when they say dumb things like that, you do just reframe it in your mind, reminding yourself that the choice is always yours. I so frequently hear, we always induce diabetics at 37 weeks. We always offer diabetics an induction at 37 weeks. Oh my gosh. Let's change our language. I hope it's getting better. But either way, an induction is always your choice. I never want you to feel forced. And in case you're looking for more information on making the choice for induction and all the myths about induction, stay tuned. I've got a good one on that one too. Okay, back to the readiness. The number one thing that you need to think about is your cervix to know how ready your body is for your upcoming hospital birth. Now, we needed a way to just share information about cervixes between people, right? Instead of going into like a whole the history of your cervix. We don't need to be doing that. And so what we came up with is something called the Bishop score, and it measures different things about your cervix and tells us how ready it is for labor. Now, I'm the first one to tell you that sometimes somebody can have a high Bishop score and their induction can still take a super long time. And somebody can have a low Bishop score and their induction can be really fast. So it really depends. Everybody's different. This is not a crystal ball, but in our experience, these things help your body go into labor a little bit quicker when we start an induction. As a note, I do not believe that there are any studies that a high Bishop score means that you're going into labor any sooner than a low Bishop score, because ultimately your cervix can change at any time. One day you might get checked with your doctor and you're a Bishop score of 1, which we're going to talk about how we get through the scoring. Stay tuned. And the next day you could go into your doctor's office and your Bishop score is an 8 to 10. Everything's constantly changing as you head into those last weeks of pregnancy. So I don't want you to think that if your Bishop score is kind of crappy today, doesn't mean it couldn't change tomorrow. Okay, how do we give you this score? Is it like the SATs? No one's going to score 1600 on this. Okay, the Bishop score has 3 things that are the big components, and that is dilation, effacement, and station. Don't worry, we're going to go through all of these too. And then it has 2 other smaller components, and that is the cervix position in the birth canal and the consistency of the cervix. So let's go through all those different things. First off, in case you haven't seen my crocheted uterus, here it is. And the cervix is just the bottom of your uterus. That's all it is. It's part of your uterus. If you were to have a hysterectomy, your cervix often goes out as well. It's just part of your uterus. I know a lot of people don't know exactly what we're checking. And your birth canal comes in like this, and the cervix is kind of at the top of the birth canal when we check you. Okay, the first thing on the Bishop score is dilation, and that means how open this baby is. I think this guy is like a 3 to 4. Depends on if I stretch it a little bit. So it just shows how open it is. This is often the thing that gets top billing when we are giving you your cervical exam numbers. It's how dilated you are, and it is measured in centimeters. With dilation, the more open your cervix is, the more likely you are to go into labor quickly with an induction. And if you look over here, I actually have a little dilation chart that we use in the hospital. I don't know how helpful it is, but there you go. That's the dilation. And you got to remember that this is just part of it. A lot of times we're like, oh, you're only 1 centimeter. But if you have all the other good things going on for you, then you could still have a very quick induction, which is why I'm glad that the Bishop score goes over a lot of different things. Okay, the second thing in the Bishop score is effacement, and that is how thick this part of the cervix is. So just like if you were pulling a tight sweater over your head, the knitting would start to get thinner as you stretch it over your head. The same thing happens to baby. And so it starts out super thick, and then it gets thinner. Now, I gotta say, effacement is a lot in the eye of the beholder. Thick is usually anything more than like 50% for most people, because we ultimately don't know how thick your cervix was to start with. And sometimes our finger cannot reach all the way through the cervix, so that is obviously very thick. But if your doctor's like, oh, you're 30% effaced, I'm like, that is still pretty darn thick. Just a little pro tip from somebody who's checked a lot of cervixes. But as that cervix starts to stretch over the baby's head and thin out, that's a great sign. And so this is given as a percentage. And usually on the Bishop score, we're looking for, greater than 70 to 80%. I actually have a full post about this that has a table about the Bishop score that I'm going to put down in the comments in case you want to see how the scoring works out. But with effacement, the thinner your cervix is, the more likely you are to be able to go into labor. Okay, the next one is station, and that is how high or low inside the pelvis this little baby is. So when the baby's head is equal with, these are your ischial spines, that's 0 station. And if they're higher up, those are negative stations. Like this is -5. Usually we just say high. And then as we get to like +4, that's when we need to call your provider because your baby's coming out. Most people come in at about -2. But again, the lower your baby is into the birth canal, the quicker usually your induction goes. And so you want to see it in those plus numbers. Most people are not plus. You want to see it, 0, -1. Those are good numbers for a Bishop score. Okay, these last two numbers, position. So as your uterus advances into labor and as your baby gets bigger and it heads into the birth canal, it actually tips forward. So in the beginning, I feel like I am checking your tonsils when I do a cervical exam. Nobody likes it, not even me. And usually if we're reaching that far back, usually it doesn't matter. And I just say, I can't read the cervix, but it's really far back there. But if we really need to know, sometimes we do have to go all the way back there. But the good news is as you progress into labor, that cervix tips forward and makes it easier to check. And that's what we're talking about when we talk about position. Where in the birth canal is that cervix? Is it right there when we go in? That's better. Is it tipped way back and I'm checking her tonsils when I check her cervix? Not good. Those get the lower scores on the Bishop scale. And the final number that you're getting on your Bishop score is consistency. How hard or soft is this cervix? We're looking for soft. As you can imagine, if we go in to check your cervix and it's hard like a tire, then that's not a great thing. But if we go in and it's soft like brie, if I don't even like brie, but like a soft cheese, then that's a good sign. It shows that cervix is ripe and prepared for baby to hit it, hopefully. So all of those different things about your cervix and the baby's position in the pelvic vault show us how ready your cervix likely is for labor. It's called the Bishop score. So if we go in to check you, your cervix is closed, thick, and high, and the cervix is kind of mid-position but pretty firm, your Bishop score is likely going to be a 1. Now, different facilities measure the Bishop score a little bit differently, I found. Again, all that information is going to be linked down below if you really want to know the numbers about it. But you got to realize that when we check you and we see that shows us that, this is going to be a long induction. Now, does it mean that we do not get induced? Absolutely not. But it does give you an idea of what you're going to be looking for your induction, or at least a guess. Because as I said, your cervix is not a crystal ball. Things can change very rapidly. But overall, looking at the general population, that's what we see. Now, let's say we check your cervix. You are 3 centimeters, 80% effaced, and baby is a -2. This is a very normal cervical exam as we get into our due date area. The cervix is mid-position in the birth canal, and it is medium. So it's not brie, but it's like a high-quality cheddar. I don't know, but it's so hard to explain these things, but the more cervixes you check, the more easily you know these things. So it's not hard like a rock, but it's not soft like brie. It's like in the middle of those. So what would your Bishop score be then? Well, the dilation would give you 2 points. The effacement would give you 3 points. The station would give you 2 points. The position in the birth canal would give you 1 point. And the consistency would give you 1 point. So that is a total of 9 points on the 13-point Bishop scale, which is awesome. I think that cervix is ripe and ready, and we will have a pretty quick induction if we go ahead and give it a start. Again, just a guess. We're just looking at a guess here, guys. And as someone who's seen thousands of inductions, I am here to tell you there is a big difference in induction from someone who's closed, thick, and high, like that first example I gave you, versus somebody who's 80% -1. Those two inductions are going to look very different. So when you hear the induction horror stories online where they say they had a 72-hour induction, if they started out closed, thick, and high, that is often what you're looking at versus the one where your cervix is ripe and ready. Now, this is one of the most important things that you look at to see if your body is ready for labor. And I think it's something that we often don't bring into the conversation. First off, a lot of people don't want to have any cervical exams. I see so many people online saying you shouldn't have any cervical exams, but this one's really important and it really gives you an idea of what might lie ahead for your induction. So I would totally encourage you, if you're considering induction, to get that cervix checked and allow it to give some input onto if you decide to have an induction or not. Again, this is for people who are really in the gray area. And as a reminder, 80 to 90% of inductions really are in that gray area. Now, the most controversial study right now in the obstetrics world is the ARRIVE trial, where they did 39-week elective inductions of people, and they did not take into account at all people's Bishop score. Now, I would love to see something similar to the ARRIVE trial, where it does take into account Bishop score, or it stratifies the data according to people's Bishop score. But ultimately, the ARRIVE trial showed that a 39-week elective induction, which means you choose, has been proven to be safe. However, it did also show that those people were in labor a good amount longer than people who went in for spontaneous labor. And if you want to know more about the ARRIVE trial, I actually do a deep dive bonus video in the online prenatal class for couples where I dive into it and how you can apply that information to an induction if you're making the choice to have one. Okay, the next one that we really need to think about is, what is your reason for being induced? Now, this is kind of encompassing the gray area for us. If you go in and your blood pressure is just sky high, they take your PIH labs, they are off the charts, you are looking at possibly stroking out or having a seizure, that is not in the gray area. Your provider should be very firm in what could happen if you do not get induced immediately. Now, this is very different than if you go in, your blood pressure is a little bit elevated, you get the labs, 1 or 2 is high. Now, your provider may offer an induction at that point, and you sit squarely in the gray area. So a lot of this is talking about how you decide if you're ready to be induced. But I think it's really important to think about the reasons why you or your provider are wanting you to be induced. And those reasons really vary. Again, like I said, your blood pressure is so high, this is really getting dangerous, versus the provider who just says, I induce everyone at 39 weeks. That's a big difference, as you can imagine. And then we have this whole spectrum of things in there. A lot of times I hear my provider said my baby looked a little bit big. We got an ultrasound and they said my baby already looked to be about 8 pounds at 38 weeks. And so we scheduled an induction and then my baby was only 7 pounds. And I have a whole post on what to do if your provider says you have a big baby, but there are other things to consider beyond just the ultrasound. And you could get another ultrasound. Like, there are other options other than just getting induced. And there are other things your provider is looking at. We can feel on the outside as like a parlor trick. I love to feel a mama's belly and then give a guess as to what I think the baby's weight will be, and then see how close we are at delivery. Yes, this is something that OB providers do for fun. And also it kind of helps build those skills as you're just feeling the mom's belly. I'm not talking an ultrasound, to see how baby's weight correlates with what you felt. So just because one test showed something off doesn't mean that you have to get induced. It means let's get more information so that we can make the choice that's best for you. And I gotta say, a lot of you get offered an induction. You're like, yes, I absolutely want to take it. Or you're choosing to be induced at 39 weeks and it is really important to you. Maybe your mom can only be in town at that specific point in time. Or your husband is getting shipped out with the military in a week. Like, there are reasons why I would 100% choose to get induced, even if my cervix wasn't ready, but you really want to weigh those different things for yourself. And I just want to remind you guys, like, if you see one lab set that's a little bit off or one ultrasound that's a little bit off, you are not a horrible person to ask, can we do that again in a couple days? Can I get an NST? I do my kick counts daily, huge fan of kick counts, and I think they can really show us when something's off as we attune into ourselves and our baby. By the way, if you need a kick count cheat sheet to know how to do them the right way, because a stunning amount of providers tell you the wrong way to do them, check my link down below. But that doesn't mean that you're a horrible person, that you're not taking their advice, but it is your provider's job to tell you what they're seeing. Can you imagine if your provider got an ultrasound that showed that baby was a little bit big and he was like, she looks fine, I'm not going to tell her that, and then baby was a little bit big and there were really negative consequences from that? Of course, we need providers to give us all the information that they have, and then we use them as the expert in the room with the other things that they're seeing to give us an idea of what's best for us, and then we ultimately get to make the choice on what's right for you. The final thing, are you ready to have an induction, is how you are coping with pregnancy. And I think this is one that we just completely ignore. I see so many people online saying, of course, pregnancy is really tough, but you just got to tough it out until baby is born. And I am here to say that we need to take into account how you are feeling as well. And you need to take into account the cervical exams and what you're going to be facing with honesty as you look at it. So let's say you're just in a ton of pain. That pelvis has separated. You can barely lift your legs. You're just miserable and you want this baby out. If your provider is willing to do the induction for you, because that's important, a lot of times you cannot get induced before 39 weeks just for I'm in pain, just FYI. But you're past 39 weeks, your provider says, yeah, I think I could get you in for an induction. Go ahead and have that cervix checked, because I really want you to know what you're facing based on your cervical exam. So you're in a lot of pain and you get checked and your cervix is closed, thick, and high, and you realize this may not be the quick out that I'm hoping for. I think I'm going to stay pregnant for a little bit longer. And I actually have some cervical prep tips. I'm going to put that link down below as well. But if you're absolutely miserable and they check your cervix and you're already 4 centimeters, 90%, baby's -1 right there, you may think, this induction might be pretty quick and I'm ready to get this baby out, and you make the choice to be induced. Now, pain isn't the only reason why you might not be coping with pregnancy. You might be one of the lucky ones who has morning sickness for absolutely the entire pregnancy. Some people get extreme anxiety as they're heading into the end of their pregnancy, and they really can't take the meds that they really want to take while they're pregnant. So that might be a reason to be induced as well. Now, I gotta say, a lot of these coping reasons are not considered reasons that they can induce you before 39 weeks. So if you're thinking I'm 34 weeks and in a ton of pain, I'm here to tell you, talk with your provider and see what they can offer you. I actually have a ton of videos on this channel about pelvic pain and different types of pain and how you can get help for them. So check those out, but talk with your provider, because they should be helping you with the pain, not just telling you that it's normal and sending you on your way. Now, I have a whole series on making the choice to be induced, but how ready you are to be induced, remember, is based off of your cervical exam, the reasons that you need to be induced, and how you're coping. So check out that video on making the choice. I think you're really going to find it helpful.